So let's go ahead and get started. And I believe everyone can hear me. I see the thumbs up with from Suzanne. So, okay, perfect. All right. So as Suzanne mentioned this morning, we're looking at recruitment really as a step ladder where every part of it builds on itself until you get to that onboarding part. And because recruitment and retention are so closely linked, onboarding is when retention starts again and so forth. So right now, what we are going to be looking at are, let me go to the next slide, the priorities, the budget, and the recruitment firm. So this is really kind of those next steps after you've really assessed what is out in the community, what can we use, who can we partner with, who is in our team. Now, what are our priorities for who we're looking for? What is a realistic budget that we can use? And for some health centers, they use recruiting firms. So that one we won't spend too much time on, but still we will go through it. Okay. So when you're putting together your recruitment priorities, and it's very important, I think all of us have like a general sense what are our priorities when we're thinking about recruitment. And the ultimate goal really is being able to bring someone in to fill the position and to bring someone in who is, the right person for that health center, who has, a mission-driven perspective, all of those things, who, really kind of fits into the culture. Now, later on, we're going to talk about how, fitting in is not about assimilating, but really bringing people in that have diverse perspectives to really help that culture evolve. But as for right now, we're talking about priorities, but I did want to make that point. And what is important with this is you also need to write it down. It should really extend beyond just, we want to bring someone in to take this position. So you need to think and define what is that big picture. Put this in your comprehensive workforce plan. This is also really important because it helps you give like historical context for these different positions, these different open positions. And you can look at where were your priorities before, because I'm pretty sure that where your priorities were before COVID are very different now, especially as there's more and more, people leaving the workforce. Again, we talked about this yesterday. Ground the work that you're doing in those JEDI principles. So one of those priorities should really be to try to diversify your workforce. Now, one of the things we heard is how complicated that can be, absolutely. But knowing where to advertise at places that specifically serve, physicians of color or nurse practitioners or whatever it may be, of going to the right places. So in your priorities, put JEDI in there. Use this information from the strategic plan that you have. Now, I do want to point out, because we talked about this yesterday, so we have our comprehensive workforce plan. These are all the components that should really go in there. You have your overall organizational strategic plan. So that's really where you're getting those main priorities. But then you also have the strategic workforce plan, and that one is separate. So I don't want to confuse all of them. This other one is specifically focused on health professions education training. So when I say use the information from the strategic plan, look at your organizational strategic plan, those overall goals. So you need to identify what are the open and soon to be open positions. Really take into account the soon to be open positions. Think about how many people are leaving the workforce, assess it, read about it, collect the data. Who may be retiring soon, even if they haven't expressed that yet? Be prepared for this. Again, be proactive rather than reactive. And identify a realistic timeline for completing the recruitment process. Again, this timeline may be very different, or I'm pretty sure it is very different now than it was during COVID. And then as new information becomes available, update it. But the only way that you're really going to hone in and see if your priorities are working, if it is what you want to look at, is if you write it down, you assess it, and you collect information from it. Part of those priorities Again, it's looking at the open positions, so those immediate vacancies that are taking place. Again, you want to write this down in your priorities. You want to anticipate the vacancy needs. So again, what I say is look at, what is the turnover that you're currently having? What are the trends that are happening in the healthcare industry? And one thing that we know, there's a huge shortage of medical assistants and nursing. So anticipating those potential vacancy needs of, the individuals who are baby boomers who are retiring now. Do you have as your priority either a succession planning or ready to open up those positions? Just having everything written down and planned out can be very helpful in a time where things can be very chaotic. You also want to look at the reason for the vacancies. So this is really important when you're doing your priorities, because a lot of times with vacancies, it's not necessarily that someone left because they were going to do another profession. Now, again, a little bit different now. But when you look at the reasons, oftentimes we see is that something is going on that could have been worked out in the retention component. So are people overworked, burnout, and I'm sure this is 100% across the board. I don't think any health center is not facing that. But are they leaving because they just didn't have enough support? Or really they just felt healthcare was no longer for them? Or what it basically is, assess the reasons. Assessing is incredibly important in order to get the right information you have. Don't assume, assess it, talk to your workforce, ask them the reasons that they're leaving, do those exit interviews, and take that information seriously and put it into your recruitment priorities to ensure that you really want to hone in, make those changes, in the job announcements, let people know what type of health center you are, what you offer, and then when they come in, really implement that into your retention policies. And then the length of time that it's going to take to fill the position. One would be, really the realistic length of time, and then the other one, the ideal length of time. And for some positions, you could keep it just permanently open, even if you have someone in, but there's such a high turnover rate that you really want to be ready with candidates for the next person who leaves to bring them in. So consider all these areas, write it down, assess what you need. So once you have your priorities in place, one of the other things that's incredibly important with that is that it'll help you assess what your recruitment budget is. And not just the priorities, but also the team, as Suzanne talked about, looking at the partnerships in the community, the assessments that you're doing, all of that are going to serve as the baseline for building out your budget. So in this slide that I used this slide before in other presentations, and it used to say recruitment is expensive, plan accordingly, and that's true, it is. But I thought it was really important to change that around and just say recruitment is an investment. And you still need to plan for a realistic budget. You have to ensure that you have the resources, in order to successfully recruit someone. And if you don't, then how do you get creative with that? How can you maximize the places where you post your job announcements? How can you maximize the individuals who are working in your health centers as those ambassadors who are hopefully going to bring in people? I mean, the people that you have in there are probably some of the most effective recruiting tools that you can talk about. I mentioned yesterday, how one of the health centers that we have present here, CCI, I know a lot of people who work there because one of them basically just kind of told everyone about working there, and so many people that I knew went to work there. So use those ambassadors, use that. But you also have to invest wisely and invest appropriately. Now, the other thing that I say when we're talking about this, and for especially talking to leadership about these things, is calculate your cost of turnover. And we have that turnover calculator that we talked about. Use it. Calculate your cost versus your cost of recruitment, and use that to bring it to leadership. Use it in the HR department so that you can see how one is a lot more expensive and the other one is an investment. So the budget is going to include many different things. So staff costs. We talked about the recruitment team when we reported out after the breakout group. So for example, Deborah in the breakout group mentioned that the behavioral health director is in all of the interview process, regardless whether they're bringing in a mental health provider or not. Well, obviously there's a cost involved in that because that's not their day job. So they're being taken from that position for a certain amount of time in order to do the interviews, ask the questions, make an assessment, really think strategically about the staff costs. But again, you want to go back to making the point that if you find the right person, it's going to cost a lot less because they will want to stay. And one thing that was really great about that is, yes, behavioral health providers and people in behavioral health know how to ask questions and know how to assess, the nonverbal cues, the verbal cues, the responses. So, utilize that, but take into account what is the cost involved with that. Outside recruiting expenses. So where are you posting? Where are you reaching out? And also be strategic about this and really go to the places that you're getting the most return for what you're paying. So your return on investment. Not every place that you're posting is going to really work for you. A lot of the trainings that we've done with health centers, one of the places where I really think makes a lot of sense to post is a website called Idealist. So it's very specific for people who want to do mission-driven work. And maybe all of you may already know about this, you may be using it. But for example, with me, that's the only place where I've gone to find any of my jobs. So it is a really great place to get the type of people you're looking for. Look at your interview expenses. It's going to be different depending on who you are interviewing. Obviously, with providers, C-suite leadership, there's a lot more cost involved. If you're bringing them into the health center, if you're taking them out to dinner, those type of things, a little bit more restricted now because of COVID, but still take it into account. And then just the hiring expenses in general. Again, as I said, turnover is expensive. So here's a link, and you'll have it with these slides, where you can go in and calculate the cost of turnover, because it all includes the separation, the recruitment, the onboarding, the engagement, all of that takes into account, and that's how you should calculate your total cost of turnover. Okay, so before we go to the next one, I just want to do a really quick Mentimeter, and I just want to know, have you all looked and evaluated the cost of your turnover versus the cost of investing in recruitment? So I'm going to stop sharing to see if Helen can share the Mentimeter.
Sorry, I didn't have it up. Let me grab it real quick.
Oh yeah. Oh no worries. Sorry about that. I didn't mean to just jump to it. Or Suzanne, if you have, oh, perfect. Okay, that's true. Many of you may not know, because oftentimes, this is held by leadership, and then there's a no. I don't see any yes. I'll give it just a moment to see if anybody else responds. So there is a yes, good. So right now, split pretty evenly. The reason this is important is because as HR providers, if that is your role, but any role that you play in recruitment, you really need to know what are you spending by losing someone versus what are you spending by bringing someone in. And time again, we hear, how do we talk to leadership? How do we talk to leadership? This is one of the most effective ways to talk to leadership. So if you don't know, and this is part of your role, ask and see how you can calculate this. Use our turnover tool, calculate it for yourself as well. So thank you so much. And sorry, I had said Helen, I meant Suzanne, so I appreciate the. Okay, so we're almost done with this section, but just a few more slides. I think it's really important when we're talking about costs again, that we also need to take into account just right now the Great Resignation. again, I don't think it's surprising for anyone. It's a really high loss, has a very high cost. So, 4 million Americans quit their job in July 2021. People have certain expectations, and if those are not met, they're very comfortable leaving. And then again, the highest resignation rates among mid-career professionals, especially in healthcare, tech industries that were the hardest hit by COVID. So all of you are in this, very difficult position, but it's not that you can't overcome it, but it does take making some very substantial changes. So as I was saying, take that data-driven approach. It's fundamental. Know where the gaps are, how you can work with them, what are the costs, identify the root causes. Again, those again are fundamental because that's what you will need to change. And it's not going to be a temporary change. It's going to be a permanent change. And develop your comprehensive workforce plans. Again, you want to have this stuff written down so that people can see what works and what doesn't. So finally, and as I said, this part real quick, just a recruiting firm. Some of you use it, some of you don't. What we really just wanted to get across here is if you use a recruiting firm, because it can be really expensive, first try to see, does this make sense keeping in-house? Do we have someone who's able to really do this role? Now, if you do use a recruiting firm, get referrals, check references, keep it in your comprehensive workforce plan, how it worked or didn't work for you, so that other people who may come into an HR or workforce role can see what are places that they want to use or don't want to use. And then also request discounts because your status is a health center or a nonprofit. Sometimes you're able to get discounts with that. Okay, so that brings us into our other breakout group. And in this one, basically, we just want to talk again about your recruitment budget. So in the chat, oh, and I see someone else said, professional network for HR execs, perfect. And then, that's great. That's a great resource. And it says we've only assessed PO costs at high level. The goal is to be able to drill down to actual cost per, right. You want to drill down to the actual cost per individual position because that is going to really show you very important numbers in this. So I see Mariah put in the slides and the assignments, and she will send this over in a moment. Okay, so let's go ahead and start with group one. That was actually the group that I was in. And one thing is that was talked about is a lot of the individuals were not involved in the budget process. So, I don't know how much we can share, but I do want to see if I think the only person really involved in the budget process is Yadira. So I don't want to put you on the spot, but would you like to share?
Sure. So for the most part, I guess as far as the interview expenses for travel and all of the things in between to kind of getting them to that point of coming on site, and even with the recruiting firms and contracting with them, if that's the route we're going with, we pretty much have it worked out to where we know where the expenses are going to be coming from and about how much those expenses are. And then depending on how many positions we're looking at, we can kind of anticipate those things pretty quickly. We haven't really worked on too much the staff cost side of it or the advertising side of it. Those are kind of the two areas I think we probably need to do a little bit more of a deep dive into to understand how much we're spending on those things and how best to budget for that, and maybe where we could pull back even on using recruiting agencies and maybe kind of upping that in the advertising level of things to hopefully offset that cost and save money.
Yeah, no, thank you for that. And I know that we had that conversation in the group, and we are going to be talking about advertising in a little bit. So more so, how to put together an advertisement, but that's also really helpful because the more that you can catch people, the more likely you also are to just save in general, and knowing where you're advertising, does it have a good return on investment? One other thing I did want to point out, Deborah, what they have is they started tracking the National Health Service Corps commitment for their providers, knowing that there is a high likelihood that they leave after the commitment, to prepare to recruit for those positions. So I just thought that that was also a really smart idea of the reality of just the potential turnover there. Okay, so group 2, who would like to share?
Yeah, so we had Patty, Heather, and Tammy in there. I'm happy to sort of summarize conversation, or one of you all feel free to jump in. Okay, I'll summarize the conversation. So I think there's a theme with the folks on the call today. Helen, I would be interested to hear what your group is, but our folks were very similar to group 1 in that they didn't really know how much they were spending on recruitment. That wasn't something that they were in charge of. But one thing we started talking about, and this is related to recruitment expenses, are the referral bonuses that are a part of the recruitment process. And so all 3 of the folks in our room give referral bonuses. Patty's organization actually gives $1,000 per successful referral. Now their chiefs are not eligible for it, but they do half, I think, in about like 90 days, and then half either 6 months or a year. And Patty, I'm sorry, I didn't write that down, but they don't do it all at once for the referring employee. But and then the other, Heather and Tammy's organization, split up their referral bonus as well. But we were talking about what a great recruitment tool referrals are. And so, even though it's not, you don't necessarily think of a referral bonus as a recruitment expense, it really is. And so just having that having that as a tool, but also a part of your expenses as well. So that was really interesting and really neat to hear about how folks were using that at their position. Another thing, Heather's organization also is temporarily offering sign-on bonuses. It might also relate to retention, but I would say sign-on bonus is probably, instead of a retention bonus, it's a sign-on bonus, so you should put it in your recruitment expenses as well. And then other expenses we talked a little bit about were recruitment firms, and most folks did not use recruitment firms or hadn't yet. So while we didn't have nitty-gritty conversations about exactly what they tracked as far as expenses, some creative conversations about what they do that could be included in some of those expenses as well. So
wonderful, thank you. Yeah, and that's so important about the bonuses and the referrals to obviously count that into the cost. So group 3, who would like to share? Oh wow, y'all have a lot. Oh, that's awesome.
I'm going to encourage someone from my group to be the report out person. But maybe we let Al off the hook since he did it last time. I can sit in silence all day, but also Danielle, it looks like you're unmuted. So no, I'm wrong. You're still muted. All right. I understand. I won't sit in silence. I won't force you to, but we had a great discussion, as our notes show, and sort of a mixed bag in terms of folks who are involved in that budgeting process and know those costs, as you can see here. And then some folks were sharing that there's been a lot of growth and change over the last several years. And so as an organization grows, sort of trying to keep track and nail down what those costs are is really complicated, but it's something they'd like to do. And then in a fun and interesting twist, our group ended up talking about grow your own programs for DAs. And that's something that several folks in our group are starting to think about or try to work on building out programs for that. And there's this interesting piece from Danielle here about there is, of course, the cost associated with training, but what's the cost of having an empty dental chair? And so it is, it balances out to be more worth it to spend the money to train someone versus to not have folks in seats getting that work done, that having those services done. And then yeah, again, sort of sharing, thinking about all kinds of different costs, including as the world opens up a bit more post-pandemic, thinking about the cost of taking folks out to dinner to show them the community, which I mentioned in my group, but I'll mention here, we'll definitely talk more about in this next portion of the day. So those are some of the things we chatted about. Does anyone from my group want to add anything or make sure that I'm covering everything well? All right, great.
Awesome. Thank you so much. And I love the grow our own. I mean, that is so valuable, so important, helps so much with turnover. So yes, always keep that in mind as well. So I believe we're now just going to take a quick break. I could pull up the slide, but it's just the same person laying back. So let's do about a 5-minute break, and then we're going to come back, do a section on advertising and social media. So we see you all back at 1:20.